Hello and welcome everyone. Good afternoon. Thank you very much for joining us today. Welcome to our Choices Community of Practice November Coffee Chat. I hope that everyone's doing well and that you've been enjoying the fall season. We're very fortunate here in the Northeast to have a beautiful day today. So hopefully it's nice weather wherever you are. The topic for our coffee chat today is an action kit for prevention, prioritizing cost-effective and equitable healthy eating and physical activity strategies. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. School of Public Health. It is my pleasure to be facilitating today's event. I'd like to acknowledge our funders who make this work possible and make a note that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate, and we're not looking to influence any specific legislation. If you are unfamiliar with the Choices Community of Practice, it is a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. We aim to support these efforts by providing tools, resources, and trainings. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. So for today, we will start by hearing a short presentation from our speaker, and then we will open it up for a full group discussion and Q&A. And we encourage all of you to share questions or comments in the chat throughout the event today. For today's coffee chat, we are really excited to share the release of the Choices National Action Kit 2.0. This is an interactive tool that allows users to explore the cost effectiveness of strategies to promote healthy eating and active living. This tool was originally released in 2019, but has now been updated to include new features and data, including more detailed information on costs, as well as the impacts that strategies could have on health equity. Our goals for the coffee chat today are to describe how cost-effectiveness analysis can be a useful framework for planning and prioritizing effective strategies to promote healthy eating, active living, and health equity. We also aim to introduce and share how the Choices National Action Kit 2.0 can serve as a resource to inform your prevention work. And as always, we hope today's event will serve as an opportunity for you all to connect with and learn from others on how you can use this data to inform your prevention efforts around healthy eating, active living, and health equity. So without further ado, we are excited to be joined by our own Dr. Steve Gortmaker. Steve is a professor of the practice of health sociology and director of the Prevention Research Center on Nutrition and Physical Activity, the Harvard T.H. School of Public Health, and he currently directs our Choices Project. So welcome, Steve. We're really pleased to have you here with us today. So at this time, I'm going to pass it over to Steve to begin your presentation.
Thank you, Molly. And thanks, everybody, for joining us today. I suppose the first thing I do is to just remind you that the National Action Kit is just a click away, and you can take a look at it. It's pretty easy. If we go to the next slide, what we've been doing over the last decade is reviewing all kinds of policies and programs that can improve nutrition and physical activity environments for kids. And we've tried to identify those that are effective, that are feasible, that can be implemented, and that really produce the best results for the dollars invested. Our overall goal is we really want to help you and to improve population health and health equity by implementing these kind of strategies throughout the United States. Go to the next slide. Our results of our cost effectiveness analyses are just lots of different outcome metrics that we think can be really useful to you. The reach of a particular strategy, the number of people who could benefit, the effect, the kind of change in behavior or cases of obesity prevented that you could expect, the cost of this. The cost we find is pretty important. Typically, policymakers want to know this. We also calculate cost effectiveness ratios, healthcare costs saved per dollar invested, or the cost per quality gained. And finally, what's really new in the action kit now is a lot of estimates of the health equity impact, both by race, ethnicity, and household income. Next slide. We've been working over this past decade to identify strategies that work in school settings, early care and education, out of school time, community and government settings, as well as clinical settings. Next slide. And we found, I think, a lot of really useful results. We've identified strategies across all these sectors that can improve population health. Some of these strategies are actually cost saving, meaning they will save more in future healthcare costs than they actually cost to implement. This is actually kind of rare in public health. I mean, some interventions like vaccines are like that, but we've also identified some nutrition, physical activity strategies that also have this character. Not many of these do it, though. Generally, the strategies that are cost saving involve adults as well as children. The reason being that a lot of the big expenses around excess weight gain and the consequences of poor nutrition and physical activity, those healthcare costs are mainly seen in adulthood, less so in childhood. So strategies that only focus on children generally require investment. But of course, we're familiar with this. That's what school is like, preschool. You have to invest in children, but for them to grow. And we do that as a society. We invest in our children. What's really interesting, though, in the latest action kit is we've identified a bunch of strategies that are projected to both improve overall population health and improve health equity. And we'll talk about that more later. Next slide. So our National Action Kit 2.0, and again, I urge you, hey, click on it and start using it. Next slide. This is a relaunch of the tool, which Molly noted, originally released in 2019, and we've updated it with newer evidence. So a couple of the strategies that were there before, we've updated with newer evidence around their effectiveness and health equity impact. And we've added in all these strategies, at least where it's available, the health equity impact of these strategies. We've also added more detailed cost information and data on the impacts on health equity, so that you can really take this information and make it more useful to your local setting. The next slide. If you go to the National Action Kit, and again, it's just a click away, you can build a comparison of up to 4 strategies. Select a few strategies that look interesting to you, and we've just selected them for you here. And then you can build a comparison. And I guess, okay, build a comparison. We've got there you go, next slide. Voila, you have a nice comparison with in this case, 4 different strategies along a number of different dimensions. From the first strategy here is promoting water consumption in schools on lunch lines. You have a behavioral change per person, a cost per person, the likely population reach, if this would be implemented across the United States, cases of obesity prevented. In this case, it's 109,000. The cases of child obesity prevented 93,000. The likely health equity impact, it's likely to improve health equity by race, ethnicity, and income. And then finally, the quality adjusted life years gained, and we go down and get other metrics too. Lots of information where you can compare across different strategies. And you can also click on the strategy report up top and get a lot more detail about this strategy. Next slide. Strategy reports are a downloadable PDF that gives lots of information about the details of the strategy, exactly what it is, or the national results, the cost results, the health equity indicators, the details of the strategy and the modeling methods, the glossary of terms and references. Lots of data about the particular intervention. And I think this is really important because interventions like this to be implemented in a community involve lots of details. Next slide. You can use these kind of results in lots of ways, locally or at your state level. You want to go to the next slide? For example, and this is particularly true with the strategy reports, by comparing these metrics, you can, across different strategies, you can come to some ideas of what strategies might be feasible in your area, which may produce the greatest impact on these outcomes that you're interested in. They may provide you with some real evidence for action and help you to guide resource investment. Well, they can also help you think about what alliances and support you're going to need to implement an intervention or a strategy like this locally. And it'll also get you thinking about likely health equity considerations. Next slide. For example, if you want to compare different strategies, you could look at the impact metrics. Which of these strategies have the biggest impact on some of these outcomes, the physical activity outcomes, or the cases of obesity prevented? You could also look at the quality adjusted life years gained, or the cost per quality of adjusted life years gained, to give you a sense of which of the interventions give you the biggest bang for the buck invested. You can take a look at the intervention cost per person to gain a sense of what might be some of the less expensive interventions to implement in your area. You can also go into the strategy reports and actually scale some of the numbers, like the obesity cases prevented per 100,000 population, scale that and to figure out what might be the likely impact in your area. Next slide. You can also take a look at the cost and figure out, well, what activities and resources are needed to implement this kind of strategy. The example here gets you thinking about chilled water dispensers on school lunch lines, what you would need to do to implement this kind of strategy in your community. What activities and resources are needed, and then who's going to benefit. Next slide. Finally, and here's where the strategy results give you a lot more detail. They give you estimates of the likely impact on health equity by both race, ethnicity, and or income levels if the data are available. And they are available for most of these strategies that we've looked at. Well, these can be very valuable because they can give you a sense of how much of a difference in health equity you could likely make if this strategy were implemented. If you think about the impact on your local community, of course, you have to think about the racial ethnic makeup, the income makeup of your community. And that's where it may be really helpful to look at some of the briefs that we've prepared with community partners, because you may find a community that might resemble somewhat your community, and they've worked to implement one of these strategies. I think we have about 50 of these briefs on our Choices website, and it may be very helpful for you to take a look at some of these, because they may give you a sense of how some of this may play out locally also. Next slide. I guess, well, there's a questions, but I think we also have a map of a choices map. Maybe that's the next slide, showing the different partners, we've worked with state and city health departments and community partners. In each of these settings, we've worked with over time to develop some projections of the likely impact of a lot of these different strategies within local areas. So you'll find these on our website. So that's a brief overview of the action kit. I know it was kind of very quick, but we wanted to just give you a brief overview and then give you a chance to ask questions and have a conversation about the action kit and its applications.
Terrific. Thank you so much, Steve. Really helpful to hear that background on cost effectiveness analysis. And I appreciate it that you highlighted what we've found through our choices work with respect to cost effectiveness of different policies and programs, and really appreciate the great overview of our new action kit, and especially those use cases for how cost effectiveness analysis can inform planning and prioritization. So that was a really great overview. Thank you. So as Steve said, we'd really like to have a conversation with folks on here today. So I'd like to move us along to our kind of Q&A and discussion portion of our coffee chat. So I'm going to start off with a question that I have here for you, Steve. Could you share some more examples of the ways that health agencies have been able to use cost effectiveness information to inform their prevention work?
Mm-hmm. Sure. Well, I think two interesting examples are the briefs from Denver and the brief from Oklahoma. In Denver, they looked at a couple of different intervention strategies. And one of the strategies they looked at was a clinical intervention that they looked carefully at to evaluate the both the effectiveness, the likely cost effectiveness if it was implemented within the Denver area. And this clinical intervention that was developed by a team at Mass General Hospital led by Elsie Tavares. And the team in Denver, along with community partners, projected, along with our team, the likely impact if this was implemented throughout the Denver Health Community Health Center system. And they found that useful, but then they also went in with the, I think the Denver story from the field is being listed here. They then went in with the team from MGH and developed a proposal, and then went ahead and implemented that strategy within the Denver Health Community Health Centers system. So I think it was a good example of how it helped them plan for an intervention and then actually work to implement that. In the case of the WIC program in Oklahoma, well, they were very interested in a pretty inexpensive program that could be implemented within WIC to really encourage households, help families reduce television time in their young kids. Kids still watch a lot of television, although they're using lots of other devices too. And they went ahead and looked at the likely cost effectiveness of this strategy, found substantial health impacts at very low cost, and realized that they could implement it. And they went ahead and did that a couple of years ago. So those are a couple of examples of how when you find an intervention that has good evidence for effectiveness, is pretty cost effective, and you work together with community partners, you very well might be able to figure out a way to make this work and implement it within your community.
Great. Thank you, Steve. Those are two great examples in Denver and Oklahoma. So if folks haven't seen yet in the chat, there's two links to stories from the field about both of those cases. So please take a look at those. I'm going to pause here. Any questions from folks in the audience? All right, I'll let folks continue to ponder. And in the meantime, another question for you, Steve. How does Choices choose which strategies to include in the action kit?
Yeah, great question. We began about 10 years ago with a national advisory group, kind of experts in this area, suggesting what strategies might be ripe to evaluate for effectiveness and for cost effectiveness. We then looked at the literature, and over, I guess, the last decade, we've reviewed about 130,000 different studies looking for strategies that are feasible to implement, that are actual strategies. I mean, you can't, for example, implement a meta-analysis, because a meta-analysis is not an intervention strategy. It had to be a strategy with good evidence for effectiveness that could make a difference in nutrition and physical activity, and therefore prevention of excess weight gain in kids. And we also needed to be able to cost out the intervention. Most of the studies that have been published didn't have cost estimates. So, for example, we've worked with some partners over time to try and cost out interventions where there weren't costing estimates from those interventions to begin with. And so it leads to a delimited set of interventions, but I think a bunch of interventions that we feel pretty confident have good evidence for effectiveness. We know are feasible because they've been tried in the real world. Some of them have been tried in a lot of different settings, and also have good estimates for their cost and therefore their cost effectiveness. But that was probably too long an answer, but that's the reality.
No, that was great. Thank you, Steve. Thanks for walking us through that. I think another, oh, go ahead, Steve.
I was just going to urge people, if you're sitting there thinking, well, what's a good question to ask? Well, just go to the action kit, play with it, and then you'll come up with a question, because probably something will occur to you when you're, or maybe everybody's playing with it right now and they're not even formulating questions.
Yeah, thanks, Steve. That's a great suggestion. Please do hop onto our website, choicesproject.org/action kit. I think we've put it in the chat a few times, but feel free to play around and formulate questions, as Steve said. I think, Steve, there were some questions that were submitted when folks were registering for this event, and there was a question about improving nutrition and food choices in school breakfasts and lunches. Could you speak a little bit to that, and how some of the strategies in the action kit relate to that?
Sure. And do we have the National School Lunch as part of that? It's interesting. I think we haven't published the cost effectiveness, health equity impact results around school lunch. We had made earlier estimates of the improvements to the National School Lunch Program under the Healthy Hunger-Free Kids Act. Made estimates, I guess that was in 2019. And we've now updated with those estimates. There was a paper published about 2 years ago showing the effectiveness of the changes in the Healthy Hunger-Free Kids Act, actually based on actual data before and after the Healthy Hunger-Free Kids Act was implemented. And those results do show a substantial health equity impact of the improvements of the quality of school lunches over time, particularly for kids in households with a poverty level income. But we haven't implemented those results yet into the National Action Kit. I believe that's right. But those will be coming soon. The results were presented at the APHA meeting, at the American Public Health Association meeting last fall in Boston. An abstract was presented there with those results, but the results haven't been published yet in the peer-reviewed journal. The other thing is we try and make sure that everything that appears on the Choices website has been reviewed in a peer-reviewed process. And so that also slows down the presentation of results on the website. Sometimes it takes a couple of years to get things approved. I know we just have a paper that was just, I think, approved, looking at the changes in the WIC program. And so that will be appearing shortly.
Great. Thanks so much, Steve. I do have a question here about the healthcare cost savings. So the healthcare cost savings mentioned in the action kit noted as savings occurred over the duration of each intervention. Is there any place to find estimated long-term cost savings for each intervention?
Sure. Yeah, good question. I think one of the tricky things about looking at things long-term is we have this thing called discounting, where you have to discount changes in the future. And what we've done is just looked at a 10-year time period. And we think that's a pretty fair period. It's a fair number of years out there, and it gives you a pretty good sense of what's happening over time. Because I was a demographer by training, I almost instinctively don't like projecting too far in the future. I worry about projecting, for example, what healthcare costs are going to be like 40 years from now. I've been surprised with what's happened over the last 10 years. And so I think it's a great question to say, well, what could happen over a longer period of time? But we think 10 years is a pretty reasonable time. We are pretty confident we can predict where changes in relative weight and obesity rates are headed over that period of time. But we worry about trying to project too far ahead in the future. If the person who asked that question feels I just dodged that question, they can reframe their question if they'd like.
Great, thanks. Thanks, Stephen. Thanks for that question. Another one I have here. So I know with the new action kit, we've now kind of added some behavioral metrics. Do you want to speak a little bit about those?
Sure. Well, we think that, usually you have to change behavior to get the kind of health outcomes in terms of prevention of excess weight gain that we're typically interested in. And so we've included these intermediate behavioral outcomes where they're available. We do have some examples of like a clinical intervention where we didn't have the intermediate behavioral outcomes, but rather we just had a randomized trial with change in rates of obesity as the endpoint. Or when we're looking at the impact of the Healthy Hunger-Free Kids Act, we have changes in rates of obesity as the outcome. And we don't really look at the impact through an intermediary. But in a number of our interventions, we do have changes in these behavioral intermediating variables, like increases in minutes of moderate and vigorous physical activity, or reductions in sugary beverages consumed. And so we've included those because people may find those really useful as they're planning and trying to tell the public about what the likely impact of this strategy will be.
Thanks for addressing that, Steve. Yeah, I think it's exciting that we have that information now to share with folks. So appreciate that. Another question I have here. So someone has shared that they work for a school district. Aside from nutrition, is there a discussion of other strategies that would work in the school setting, especially since cost-saving results are not so obvious in children?
Mm-hmm. So that would have what impact on health? They were talking about nutrition strategies with maybe they can specify what health outcome they're interested in, because one of the reasons we started Choices is we wanted to figure out what you could do by the steadily increasing rates of excess weight and obesity in the United States. And so our first goal has been to figure out, well, what strategies can we implement that would start to flatten out these rates and make a difference here. So we've had this excess weight gain as a primary outcome that we're interested in changing. And when they're talking about other strategies in schools beyond nutrition, well, we certainly have the physical activity strategies that you can see on the action kit, but were they interested in other outcomes besides this outcome of excess weight gain or rates of obesity?
It sounds like general health, diabetes, obesity in particular is the interest.
Yeah, well, I think the evidence is that by far the biggest impact on excess weight gain and future diabetes incidence is really to improve the nutrition and nutritional quality of kids' environments. At the same time, you can improve those physical activity environments. And I think both of those are probably the main determinants there for excess weight gain and future diabetes incidence.
Great. Thanks, Steve. Another question. So earlier on, someone had a question in the chat about QALYs and what those are. Could you just speak a little bit more to what QALYs are and why we can use them to set priorities for strategies to improve health?
Sure. Quality adjusted life year is just one way of describing a fully functioning individual that doesn't have any disabilities or pain or other sorts of issues that would impair their quality of life. And we use QALYs as a way of comparing across many other different types of health outcomes. And one thing that people have found repeatedly in studies of individuals with excess weight gain, whether it's children or adolescents or adults, is there are reductions in the quality of life associated with that excess weight gain, particularly around issues like pain and disability. And also for children and adolescents, there's an emotional and psychosocial dimension there. Some decrements to their quality of life because of the excess weight. It's a smaller impact for kids, and it tends to grow with the amount of excess weight gain and grow over time. And so we use QALYs as a way of being able to compare across different treatments and different health outcomes. So there's kind of a standard metric.
Thanks, Steve. I think another question here that folks often wonder about is who's paying for these activities. So how can we learn who might pay for these things in different payer categories? Anything you can share about that?
Yeah, that's a great question. And we think that's why I think particularly the folks who are involved in trying to think about how they might implement some of these strategies in their local areas will find the strategy profiles particularly useful, because it has a lot of detail about what needs to happen for these interventions that take place. And different individuals will have to pay for these interventions. And it depends on the intervention. And sometimes you can get others to pay for these strategies, like a sugary beverage excise tax, for example. Part of that intervention is really just going to be paid by the sugary beverage industry, because they're going to have to pay the tax. Actually, that doesn't go into the cost of the intervention, but they do have to pay a tax, and they do have to make some changes. Well, there will be certain things that have to happen at, let's say, the state or the city level to implement the tax. They have to send out bills to distributors and information about the tax. But one of the things that there's a good deal of experience in how to do this, and you can find some of this in the strategy reports. if you're interested in implementing water dispensers on school lunch lines, well, certain types of equipment have to be purchased. Certain activities seem to have to happen, and a lot of those can be paid for at the local level or the state level, but it really depends on the particular state and the a lot of different things happening. That's why it's useful to take a look at some of our examples. I think we have a nice example that we did with the California Department of Public Health, and the details of the cost and what the plans might be in California to implement a strategy like that there.
Great. Thank you, Steve. Yeah, just to echo what you said, we do have those cost results and kind of a cost breakdown available in the strategy reports. So there's only 6 available on the kit right now, but within the next short term, we'll be filling that in for all the other strategies. So definitely encourage folks to take a look at those reports, and in particular, the cost results section, to see more about what Steve was talking about. So a question that I have for all of the folks in the audience, if anyone would like to chime in, either feel free to come off of mute or you can share in the chat. We'd really love to hear from all of you on how you think you might use this data and information in your work. So please feel free to chime in.
Don't all speak at the same time. One thing I will mention is that the amount of data that we've now made available here, particularly if you're looking at the health equity impacts of different strategies, and then all the cost results, but there's a lot of data there. And but to be honest, it took our team quite a while to start to feel comfortable with knowing what these estimates meant and how they could be used. And so I don't think I would be intimidated by the numbers, but rather see them as something that over time you can start to get used to, and think about how they really might be useful for you in planning what you might want to do within your community. And we do plan to put out more documents that talk about how you can use some of these results and tailor it more for your local community. Again, right now, this national action kit does give you a sense of how these different strategies compare to one another if you're just comparing across the entire US population. If you start to think about your local population, well, of course, it's going to be a lot smaller. It may look a bit different than the average US population. And so you'll have to maybe change things a bit or alter it a bit to make it relevant to your local setting. But I think you still should be able to take a look at these national results and say, well, they still give you a relative sense about how these different interventions, if implemented, stack up to one another and their ability to change physical activity levels in kids, to alter their nutrition, to improve their nutrition, to prevent excess weight gain, to improve health equity. You do get some real distinctive differences as you move across the country. And I think that's where some of the studies that we've done with partners can be useful. Take sugary beverage excise taxes, for example. You might want to look at the brief from California, well, that's now been published in a paper in the American Journal of Preventive Medicine. Compare the results for California with the results for Hawaii, the results for Alaska, the results for New York City, and you'll see some kind of substantial differences, a lot of similarities. I mean, in all these cases, this is projected to be a cost-saving strategy, one that can, independent of the cost-effectiveness analysis, produce a lot of revenue that can be used for lots of other interventions. but it also has distinctive health equity impacts. For example, in Hawaii, it's will substantially, if implemented there, it would substantially improve health equity, particularly for the Native Hawaiian and Pacific Islander populations. In Alaska, it would, in particular, improve health equity for the Native Alaskan populations. And if you look at the national results, those particular populations aren't even discussed because they're too small in the national results. And so that's where the results really may vary across different parts of the United States. So the health equity impact may really vary. And it's useful to think about how they may apply in your area.
Thanks, Steve. That is very helpful, I think, for folks to hear those different specific examples. So as Steve said, those many of those examples that he was talking about are available on our website in brief or report form in our resource library. So please do take a look for those to see some specific examples. And it looks like folks have been sharing some great insights in the chat. Honor is sharing that she would love to share it with their coalition on food access and security to galvanize action and direction. So appreciate that. Allison agrees, would love to share it with community partners. Myrna shared that the information is thought-provoking. It will guide in teaching parents and also going to look into the chilled water for school sites. That's great. And looks like Joe shared a long response here about comparing school lunches between metro and urban areas versus rural areas. So really appreciate what folks are sharing in the chat. So
yeah, thanks for those.
Yeah,
thanks for those comments, Joe. That really fits, I think, with our sense of what's been happening in school food services. The study that we currently have and will put into the action kit pretty soon is just about improving the quality of school lunches under the Healthy Hunger-Free Kids Act. But I think you're absolutely right that these kind of strategies where you can really do lunches made from scratch are generally going to be better. We found that actually in some published work in after school settings. That was actually the OSNAP study, and that's actually the out of school intervention listed on the Choices website. But I think you're absolutely right. These are other kind of interventions that we'd like to see documented around their effectiveness, and then particularly around the cost. So we could do some cost effectiveness type studies like this. Thanks for that comment.
Yeah, terrific. Thank you for sharing all of that detail, Joe. That's great. We usually at this point in the coffee chat like to ask folks to chime in the chat and share anything that you're going to take away from today's event. So something you learned, something new, something you're excited about. I think some folks have certainly already shared that, but if you haven't, we'd really be interested to see. So please take a moment to do that. But any final questions from the audience here, or any final thoughts that you have, Steve, particularly any details that folks can consider when they're prioritizing strategies with key partners and decision makers?
Yeah, I think, say Jonas Matta said, do you provide technical assistance to local communities regarding the model? We have in the past worked with more than 20 different state and city health departments in developing models. We hope to do more of that in the future. And so we'll see how that plays out. But in the meantime, I think you can just start exploring the site yourself. And we do intend to provide additional resources that can provide you with additional training in the use of cost effectiveness analysis, and then how to take these action kit results and roughly use them to apply to your communities. And I think well, there's a number of ways of doing that that I think make a lot of sense. So that's to be seen in the future.
Terrific. Thanks, Steve, and thanks for that question, Jonas. I think that's a great segue. I just want to share a few final notes here. So you can register to join our community of practice online portal, where you can find all kinds of resources, and you can also see our contact information if you'd like to reach out to us with more questions or follow up about anything. So please take a moment to register as a member if you have not done so already. Please also feel free to share any suggestions for topics for future coffee chats. We will be having our next coffee chat in the new year, January 25th, I believe is shared on the slide there. So we will not be holding a December coffee chat, but we'll be reconvening in the new year. So if you have suggestions or ideas for coffee chats in 2024, please do share those ideas in the chat. We'd really love to see. I'm also just going to note there will be a little survey that will pop up as you leave the Zoom meeting today. So we really encourage you to take just a moment or two to fill that out and let us know how we're doing. And as a reminder, we will be sharing a recording of the session today in our follow-up email. And we'll also be posting that on our website. So please stay on the lookout for that. But I just really want to thank Steve so much for coming on and sharing all that great insight into the action kit and all of our choices work and cost effectiveness analysis. I think it was really great to hear, and appreciate everything you shared, and appreciate all the great questions that folks asked today. So thanks everyone for your engagement, and thank you, Steve.